Well, welcome everybody to Intro to Healing Touch. So thank you very much for being here. My name is Jane Beese, and I'm a nurse, holistic health coach, and certified Healing Touch practitioner and instructor. And I've been a nurse for going on 34 years, and I learned about Healing Touch in my 23rd year of being a nurse. And once I learned about it and started weaving it in at the bedside, I just saw how much it helped the patients, and then I just felt very drawn and called to do this with patients in the hospital. So I started calling around other hospitals, finding out how did you get Healing Touch in the hospital, and one thing led to another, and then now Methodist Hospital where I work has it there, so it's pretty awesome. And all this information is, this is complimentary care, so none of this replaces any of your medical care or your mental health care, all that stuff. So this is all just complimentary information. So this is a picture of some twins that were born 12 weeks early, and one of the twins started to fail. And then the NICU nurse asked the doctor if they could be put together in the same incubator. And the moment that happened, the stronger twin put her arm around the weaker twin, and then the weaker twin, the heart rate stabilized, temperature went to normal, and oxygen level increased. So that just shows you the power of touch from the very beginning. And also, I learned not too long ago, in the 1920s, in America, we had a really high mortality rate for children that were 0 to 1. And then there was a doctor who went to, a pediatrician who went to Germany, and they had, their mortality rate for 0 to 1 was low. And so he was trying to figure out what's the difference. Well, they had hired a elderly woman to hold the babies. So, even though we had, clean environment and nutrition for them, that still wasn't enough. You gotta have that touch too. So what is Healing Touch? Healing Touch is a relaxing and nurturing, it's a heart-centered energy therapy. So you've heard of massage therapy and physical therapy. Well, this is a form of energy therapy. So, and I like the analogy of how the car works better when the 4 tires are balanced and the oil is clear. Well, your body works the best it can when your energy is balanced and clear. So Healing Touch is safe for all ages, and it's complementary to standard medical care. So I've worked with NICU babies that were just little tiny, up to a 107-year-old. That's the oldest person I've done Healing Touch with. So, and she could still get up and walk to the bathroom, and it was amazing. So what is healing? Healing means to be whole. So none of this is a cure, but it's healing. Healing means to be whole. It comes from a Greek word, halen, which means being whole in body, mind, and spirit. And then all healing is self-healing. So, if somebody breaks their leg, the doctor might reset it, but who's doing the healing? It's that person. So when I teach the classes, we say it all the time, like the healer's on the table. So we're just helping put them in that optimal state to heal. And just a couple quotes from our Florence Nightingale, our famous nurse, nature alone cures. What nursing has to do is put the patient in the best condition for nature to act upon him. And then the father of modern medicine, Hippocrates, said, natural forces within us are the true healers of disease. So with Healing Touch, it's a light touch on or sometimes above the body, and it helps the body to relax and balance, and then when the body gets relaxed, then it's in its optimal state for its own healing. So they don't know exactly how it works, but they know it works. There's some theories, one being when the body relaxes, they have done studies where they've shown the DNA sheaths open up and release healing chemicals. And so that's one of the theories. And another one is remembered wellness theory, and that is where, you know, my body being, the practitioner's body being in balance and clear, then gets in with the person that's on the table, then it helps their body to remember how to get in that balanced and clear state. So that helps it to heal. And then the other theory is placebo. So we all know placebo works, right? That's been proven a number of times. So some of the benefits of healing touch: easing pain, lower anxiety, and help bring around relaxation, peace, and calm, and well-being. And who can benefit? Everyone. But specifically in the hospital, we've done healing touch with patients and family and staff. And so just to give you an example of each of those, with a patient he was in with a bowel obstruction and he was scheduled to have surgery. And I went in there he was my patient, and he was having a lot of pain, but he didn't want to take any more pain meds because he was still holding out that he would have a bowel movement. And you know, he knew, his wife was a nurse, so he knew, like, if he took the pain meds, then that would potentially slow down his bowels. So I was like, and this wasn't long after I took Healing Touch Course 1. So I was like, well, I have some extra training. I could try this technique that might help your pain. And so he said, sure. And so I did some of the techniques to help decrease pain, and he relaxed and he actually fell asleep a little bit. And then I left, and then the next time I came back into the room, he was like, hey, will you do that thing again? And I said, sure. So this time he fell asleep a little deeper, a little longer, but his wife said about 15 minutes after I left, he started passing gas. And then later that shift, he actually had a bowel movement and he didn't have to go to surgery. So, you know, it's a combination of all the care he was getting, but his wife thought that the Healing Touch did really help him. So, thanks. And then with family, you know, they go through a lot too in the hospital. There was somebody who, her husband had a stroke, and they were like, didn't know which direction to go. Do we keep going with cares? Do we put in the feeding tube? Or do we let him go? You know, because we don't have a crystal ball to see where that's going to go. So she was having a lot of stress. She was a nurse also. And so I went and did what we call a Knowles mind clearing with her. And she got very relaxed. And afterwards we were walking back to the room. And she said, thank you for that. She was like, you reminded me of how important touch is, and that's all I have right now. And I was, you know, nodded and stuff. And then when we walked a little bit further before we went into the room, she said it again. She was like, you don't understand, like that, you know, was all I have right now, because she could do that with her husband. So. And then with staff, headaches, you know, not so long ago, I walked by somebody with like this at her desk, and she's trying to chart, and so I just started talking with her, and yeah, she had a headache, and it was kind of close to getting to a migraine, and so I was able to do Healing Touch with her, and it helped ease off her pain a lot, and then she was able to finish out her shift. So some of the physics behind this is anywhere energy's moving, like in a human being, we all have that electromagnetic field around us. So, and that's how we get EKGs and MRIs, is that electromagnetic field that's around us. And the human body emanates a frequency of energy, and it can even be measured. Sometimes we can measure it off the palms of our hands. So it's been measured to 2 to 15 hertz, which is within the range of one of the machines that they use for non-union bone healing. So that's set at 8, and so it's pretty awesome. You got that right in your hands. And then the science, like I said, we all have that electromagnetic field around us, and it interpenetrates. And also, it's the term that the National Institute of Health and medical schools came up with was the biofield, because there's a number of ways, you know, you've heard it called aura and there's a number of different terms, but they decided that a biofield would be a good one to describe it. So that's what we use. And like I said, it's in EKGs, MRIs, that's how we get those, is that electromagnetic field around us. So Einstein called this subtle energy because we can't see it, but we know the effects. We see that there's effects. So similar to gravity or radio waves, you can call somebody across the country with your cell phone. You don't see those waves, but we know that they're there because you can talk. So same with this, you can't see the energy, but you might see somebody get more relaxed, or you might see their pain decrease. So, and then you guys have all sensed it, even when you walk into a room and you can tell two people have been fighting or it's tense in the room, and you just feel it when you walk in, right? So you're sensing energy, and that's one of my favorite things about teaching the classes, is that people will share things, they're like, I already do that. So some of the stuff you naturally do already. And we have these biofields, our energy fields, they extend out, like they just keep going. So our fields interact with each other, they're unbound. They have patterns, but they're unbound. And so with the energy work, you have the practitioner, and then you have that merging of your fields and the client. So, and this aligns with the nursing theorist Martha Rogers. She taught about that. This is a picture from HeartMath about how our heart is our biggest emanator of our energy. It's 60 times more amplitude than the brain, which is second in your body. And also the heart sends more energy or more messages to the brain than the brain does to the heart. And they've actually known this since the late 1800s. So this is very heart-centered work, and we tap into that heart energy, and that helps amplify the healing environment, the healing work that we do. So when we're in dysregulation, you have that jaggedy waveform. So you've been around somebody who's really stressed, and you're just like, you can just feel it. And then you've been around those people that are just relaxed, or those people that just feel good to be around. They have that nice sine-like waveform. So when we're stressed, we get more of that jaggedy waveform, and then when we're feeling calm, or feelings of appreciation, joy, things like that, helps get you in that healing environment, that healing wavelength. And we'll do I'll walk you through an example for you to experience that, called heart focused breathing. We'll do that later. So with energy, when it's blocked or unbalanced, then it can lead to pain, disease, or feeling unwell. So when our energy is like a river, and it's always flowing, but sometimes we can get a log jam, and that's where the pain can be. So maybe a surgical site where somebody's trying to heal, they can have pain there. It can be a congestion there, and so we'll do some of the techniques to help. The techniques help to clear, energize, and balance. So that's what the techniques do. So, and when you're receiving healing touch, you might feel a relaxation, a warmth, vibration, movement of energy, peace, calm. Like I said, the discomfort might just decrease, and just a sense of well-being. And everybody's different. Every individual's different experience, and then each time that same person gets it, it's new each time as well. So these are some of the clinical applications that Healing Touch has helped with, and I'll just share a couple examples. So there was one patient a young gal who had a new diagnosis of pancreatic cancer. And when she came up, she was having a lot of pain, and she was distraught because it was a new diagnosis. And I did one of the Healing Touch treatments with her called the Knowles Mind Clearing, and she got really relaxed and fell asleep. And then the next time I went into the room, she just had this look of peace on her face. So, and there was somebody who a young man who had cancer, and I went in to give him a Healing Touch treatment, and his wife had just left, and then I gave him his treatment, he fell asleep, and I left, and then I went in the next day, and his wife was telling me the story that later in the afternoon, late afternoon, she had asked her husband, like, have you taken any pain meds lately? And he goes, I haven't had any pain since I had that treatment. And he had been taking pain meds every 2 hours. So, and he still wasn't having it upon discharge, but they went ahead and gave him some prophylactic before he went home. So it doesn't always turn out that great, but that was a really good one. So, and then I had there was a young gal after surgery. She had a history of mental health, and she, when I got the call, and when I got to the room, I just heard the nurse kind of yell, like, I'm just trying to help, and then she came out of the room, and then I went in there, and the patient was just in tears, because she was like, I just knew this anesthesia was going to mess with me. I was trying to be good, and she just, really reacted, and then, so I just told her to have compassion with herself. Like, sometimes that happens with the anesthesia. It can really do a number on you and stuff. And so I just listened to her a little bit, and then I asked her if it was okay if I did a little Healing Touch with her. Well, we always ask permission to touch, if we can touch, because some people have a history, or they don't like that. And all these can be done off body. So she didn't want to be touched, so I did one of the techniques called modified mesmeric clearing, where you just go over the top, and I did like 3 or 4 passes, and she kind of got a shiver, and she was like, okay, I'm good, and she felt a lot better. Like, it didn't take very long, and she told me to tell the nurse to come back in, because she wasn't letting the nurse hang the IV or anything, and so she was like, you can tell the nurse to come back in and hang the IV, and I tell her I'm so sorry. And then, so I went back out there to tell the nurse, and she was on the phone with the doctor, and I heard her say, like, she won't let me hang the IV, or, do your orders and stuff. So I mouthed to her, like, no, she said you can go in there now. And so then the nurse told the doctor, oh, never mind, Healing Touch said that I can go in there now. He must have said, what is Healing Touch? Because then I heard her trying to explain it. So it's kind of funny. But yeah, that was, and again, it's that, the healer's on the table, right? I'm helping hold the space for her to do her own healing. So she did an amazing job. So. The credentialing, that is, this was all started by a nurse in the 1980s, Janet Menken, and she studied and practiced, different cultures, science, and she did a lot of, practicing, and if she found something to work 100 times, then it found itself in the curriculum. Because then, she was very gifted, and the American Holistic Nurses Association came to her and they said, hey, you got to share this. Like, so that's how the program started. And the credentialing was done by the American Holistic Nurses Association. Well, you don't have to be a nurse to do this. Like the founder said, if you have heart and hands, you can do the work. And so many people started taking it, and it was overloading the American Holistic Nurses Association. So then they turned it over to Healing Touch International, Healing Beyond Borders, to do the credentialing. So, and that's where I got my training and certification. So, and it follows the nursing process and the scientific method. And we also go through ethics and standards of practice. The classification for nursing is, the diagnosis is called the imbalanced imbalanced energy field. And healing touch is considered a nursing intervention, so we don't need a doctor's order. So when we put it in, you can just put no cosign required. So, yay. And then to get certified, there's 5 courses and then a certification process after that. But, and then with that, after course 4, you have a mentorship, a minimum of 1 year. And it's a really rich year where you give a bunch of treatments, you have to give 100 treatments and document, experience 10 modalities, you read books and do a little write-up, and a community project, and so forth. And so the minimum to get certified would be 2 years. I did it in 3 years, but that's what I love about this too. Like, you don't have to, you can take as long as you want, so, to do it. But course 1 is enough to make an impact. So you take course 1, you have the meat and potatoes, and you can start doing the work. So, and that's what I did, and I just started weaving it in wherever I could, and anywhere from the hospital, or I even did it in the Capitol bathroom one time. There was a lady there with back pain, and she was froze laying on a bench, and moaning, and so I was like, ma'am, you okay? And so yeah, she told me about her back, and then I did what we call a pain siphon on that, and then she was able to get up. So, and that was a founder's dream, is that every home would have Healing Touch in it. So Healing Touch is in Omaha at Methodist Hospital Children's, various hospices. I know Peaceful Hearts Hospice has it. The VA has it. The vets, they love it. Some long-term care facilities and private practice. And worldwide, different hospitals, integrative centers, medical centers, cancer centers, support groups, and spas. And then Healing Touch is also evidence-based. So we have this Healing Touch research brief that, there's a bunch of studies that show that Healing Touch does work. And in the back of this, there's like 11 pages of references that talk about different studies. Like, one of them is the open heart surgery patients. One of the things they measured was length of stay, and 100% of the people who had Healing Touch left earlier than the typical 6 days length of stay. There's been studies that show where it will help with the counts, say like in cancer patients. And one of my mentees, her daughter had cancer when around 10 or something, and she was going to the Mayo Clinic, and she would get energy therapy done there. And she was like, the mom was like, this is a bunch of woo-woo, she didn't believe in it. But then her daughter's counts just kept getting better every time, and so then she started to really believe it, and her daughter's alive and well, and then her mom, through the doubter, she's working towards certification now. So this was the first pilot study we did at Methodist Hospital, because, God bless you. So when I was first trying to figure out how do we get Healing Touch integrated in the hospital, when I called the other places saying, how did you get Healing Touch in your hospital, one of the things that they said was, one of the most common things was they had all done a pilot study. And so that's what we did. We decided to measure pain, anxiety, and nausea. And we had a significant improvement in all of those. We ended up rating 46 patients. So we would have done more, but it was March of 2020. Need I say more? And then this is one we did with the NICU parents. So they have like the most stress of anybody I know, because they're dealing with their little baby. They might have other children at home, or finances, or just. So we would give healing touch treatments to the parents and measure their physical, emotional, mental, and spiritual well-being. And we got positive results from that. And here's a few comments. One said, "So great to have a mental, emotional, and physical break from the NICU and those stressors. And the healing touch treatment was very relaxing, probably the most relaxed I've felt since delivery. Wonderful, able to shift negative, painful thoughts to peaceful, calm, and gratitude." And we had one mom call and leave a message on our machine because she was thrilled because she produced more breast milk after she had healing touch. So some of the bonus with healing touch is that it's great for self-care. And they did a study with nurses, although you could apply this to anybody, but the results were that they could apply their holistic concepts more easily, their coping skills improved, and then nurses that were around those other nurses that were trained in healing touch find themselves feeling more calm too. And then with healing touch, we talk about healing presence. Well, how do you become very present? And there's even studies that show how presence helps. They had some doctors seeing some patients that they had them get real present with them during their sessions, and they found that their diagnoses were more accurate, and it didn't even take any more time because they could trust them, they felt better about it. And so there's a difference of being there and being with, like both of them, to optimize the healing environment. So we do some grounding and heart centering to do that. Before we do the grounding, I just want to share a couple other things that healing touch has helped with. So it can also help at end of life, and I had a patient who, a young gal, went in to do healing touch with her, and as I was going, and her husband, I was holding, we have energy centers in our body, so I was putting my hands there, and he was like, "What are you doing? Pushing on pressure points?" And I said, "Oh, that's a good question. I'm holding one of their energy centers just to help her body relax and balance." And so he was kind of intense, but then he gradually kind of lightened up. But I was outside of the room later, and I was just charting, and he came up to me and he said, "I don't know what you did, but I'm a believer, and you can use this as a testimony." He said, "She hasn't pooped in 10 days, and she just did." So it can help with all kinds of things. So I didn't even know what was going on with her, but we set the intention for the highest good, and energy goes where it needs to go, and it helped her with what she needed in that moment. So that's another example of how it can help at end of life. And I've seen it too, where there was one who you could tell she was just struggling and just trying to figure it out on how to get to the other side, and she was like, "I think my nurse is tired of me," and she just was struggling, but she got really relaxed with the healing touch and calmed. And so it's wonderful to be able to do at that time too. And we had nurses at Methodist that went into patients' rooms during COVID to do that with them. There's a specific one that we'll do at end of life. And when some people were alone, they couldn't be with families, so that they would go in and do this with them. So it was very beautiful. And then this is collaborative care. So I've co-treated with wound care, when they're doing a wound vac change, or that can be very painful. So I'll be in there with the patients while I'm doing that. or physical therapy or cath lab. I've gone into the patient's room. There was when I was at Children's, there was a young boy who couldn't have sedation. He needed a heart transplant, and his heart was so weak that they didn't want to give him any sedation. And so here you're supposed to go into this heart cath with no sedation. Well, I had worked in cath lab before, so offered to go in there with them. And so and the surgeon wanted me to go in there because I had given him treatment before, and she's like, that way he'll recognize you. And he did. He was really good, and the whole staff was really good, but he even fell asleep a couple times during it, so, and no sedation. So, but like I said, it was the whole team of us. And again, I'm not necessarily doing those full-on techniques, but just that healing presence that we learn with this, or that you're naturally doing at times anyway, and so it really helped him. So I'm going to just walk you through a grounding and heart centering, and then I'll guide you through what we call the glymphatic support technique, one of the techniques we learned actually in course 2. And it's not lymphatic, it's glymphatic, the letter G. And it was discovered in 2012, Rochester in New York. That medical center discovered it, and it's a system in the brain that helps sweep things out and clear it out. And it can help clear that beta amyloid protein out, that one that's responsible, they think that's tied with Alzheimer's and dementia. And so they found that this can help clear out the debris. And it usually works at night when you're sleeping, but you can do healing touch and you can get it to work during the day too. And one of my instructors, she said she thinks everybody should do this at night before they go to bed. So it's 6 holds around the head, and I'll guide you through it. So, and they did a pilot study with Alzheimer patients at the University of Iowa, and it demonstrated a clinical, a significant improvement in mood and depression, which wasn't typical for that group of patients. So with grounding, what is grounding? Why do we ground? So a healthy human and then the Earth's frequency is the same, but our frequency gets thrown off with, we're around all these electronics and cell phones, computers, and stress. Stress can throw off your frequency too. So when we connect back with nature, with the Earth, that helps us get back into that healing frequency. But you can't always get there, right? We're in the hospital or you're at your work or whatever. You can't get to the mountain or the beach, but you can get there with intention. So a little bit about intention is that also has been proved with science. They at Princeton, they had an electric coin flipper. And so like heads or tails, right? And usually that's going to be 50%, but they would have people intend that more heads would be flipped. And sure enough, well above that 50% of the heads would be flipped. And also an example with Healing Beyond Borders, when they had their international conference, and it was in North Carolina, I think in 2012, they had set the intention that these seeds, which were actually in Arizona, so this works long distance too, but they set the intention that these seeds would grow twice as much and faster and taller than the control group. And sure enough, the seeds that they intended to grow taller and faster, and then they did. It was just under 50% more, I think, that grew. So that's another example of intention works. So even though you can't ground by being on the mountain, you can ground with intention, and that's what we do when we do healing touch. So why ground? Well, it helps keep you, stable, strong, helps keep you from shorting out, that lightning rod, how that helps so that your whole house doesn't short out. So it can also, if you stay grounded, your you're staying grounded in your own energy, so it can help you not take on other people's. So you can still sense other people's, but you don't necessarily have to take it on. Like you can recognize it, but not take it on. So, and the Earth's frequency and a healthy human frequency is 7.8 hertz. So that's a little bit about grounding. And then heart centering, that is a frequency to get into. Remember that nice sine-like wave that we want to get that I showed you at the beginning? So when you think of things that bring you joy or make you smile or something that makes you happy, then that helps you get into that nice frequency, that healing frequency. So one of my teachers says babies, puppies, kittens. So that's how that slide got up there. But so just thinking about those things. So we get heart centered, and then that amplifies that healing presence that you have with the person. And then that's the glymphatic treatment that I'm going to walk you through. I'll just guide you through that and then we'll have questions afterwards. Okay, so go ahead and just find your feet on the ground. Notice your breath. Take in some nice, easy breaths. Remembering to fully exhale. Sometimes we forget to breathe out. And we can't get a good breath in unless we're breathing everything out. So as you breathe in, notice your feet and connect them to the earth. Feel the bottom of your feet. Picture yourself, your favorite place in nature. And our Creator gives us food to eat, water to drink, air to breathe, and also the earth's energy. So you can feel that earth energy traveling up from the core of the earth, up your feet, legs, your core, your shoulders, neck, and up over the top of your head, and just feel that wash over you. And then from the light above, that light that's available to all of us, just feel the rays pouring down throughout your body and noticing it at your heart. And you can even hold your heart, send a message to yourself that nurturing. And just breathe in and out throughout your heart. This is called heart focused breathing from HeartMath. And as you breathe in and out throughout your heart, think about something that makes you smile or something that you're really grateful for. And then the first hold for the glymphatic support technique is you're going to put both your palms on the back of your head, fully covering your occipital ridge. So your occipital ridge is where the base of the skull and the top of the spine meet. So you're going to hold them. Just nice, easy breathing. And then leave one hand back there and the other hand put on your forehead. So even putting your hand on your forehead helps bring the blood flow to that frontal lobe. When we get stressed, we can lose up to 75% of our blood flow to the frontal lobe. So even by putting your hand there, we're magnetic beings, so that magnetic within your body, your bloodstream, helps pull that blood flow back to your frontal lobe. And then cover your forehead and eyes. I really like this one because our eyes work so hard for us, so it's just nice to give them some love, some comfort. Remember your breathing. You're grounded, you're heart-centered. And then hold the top of your head. And then your ears and sides of your neck. And then when you're ready, you can ground yourself and come back to this space. So that's like lymphatic support. So, and there's something about that last hold, I don't know exactly what it is, but something extra special about that one, just holding the ears and the side of the neck. And an example of that is that I had a patient who, she had aortic aneurysm, she had surgery, and she had encephalopathy, that swelling in the brain, and she was just really restless and just moving nonstop. And she was very pleasant, and her daughter was amazing with her, but she just like was moving all the time and pulling at things. And so I was trying the typical things that I would do, and it just wasn't cutting the mustard. So then I just got a hit to like, okay, just hold her ears and her neck, and I did that, and she just held still. And then we all looked at each other like, wow, you know. So, and I've had other people, when I'm doing that, they'll make a comment when I get to that hold. So, and that's what's nice about this healing touch. These, you know, we teach you different techniques, and there's different steps in the techniques. Like this one has 6 steps, but you know, sometimes when you're weaving it at the bedside, you know, you don't have to do them all. You can do bits and pieces, so, and it doesn't take very long, and it can really be helpful. So, yeah. So that's a little bit about healing touch. So, you guys have any questions or comments?
How much pressure would you do? Like, are you really light touching, or are you kind of like
Very light.
touching, or, okay.
Yeah. So, how much pressure was the question? It's a very light, just a feathery, light touch. So, yeah. Thank you for asking that.
So is healing touch an umbrella and things like Reiki be included? Am I saying that right?
Yeah.
Is that included in this, or is that a separate practice?
They're both energy therapy,
Mm-hmm.
both very helpful, and the Reiki comes from the Eastern tradition, the Japanese, right? These guys are trained in it. So. And then healing touch was the energy therapy that we learned from the nurse here in the States. So, yeah, good question.
What about how you can do it from like afar or like over the phone? How does
does that work?
Yes, you can do this distance. So, not that I know anything about quantum physics, but like that, or prayer, it reaches across. So you can do this work long distance. So you treat it just like you normally would, even if you were in person with them, and it's quite amazing. So, and I mean, I can speak from my experience in receiving it or giving it, how like it's so powerful. You really feel it, just as if you're getting a treatment in person, and had it decrease pain. Yeah, so there's a number of ways you can do it. You can do it on the Zoom. I've done it. I recently did it with a gal. My mentor, Dr. Oliver, he's in California, and he sent me a referral for a lady she's out east somewhere, I think Jersey, but she's 89, and so she wanted a treatment, and so I had my FaceTime on, and she was holding hers, and she was laying on the couch, and she got really relaxed, and then it was kind of funny because she'd fall asleep, and then the phone would be pointing toward the ceiling, and then she'd wake back up, and then I'd see her again, and so, yeah, you can do it long distance too. And one time at the hospital, there was somebody who was having excruciating pain, and he was thrashing around, and I started doing healing touch with him, and he did calm a little bit, and then all of a sudden he was like, I gotta shower. So I don't know how his nurse got the IV unplugged so fast, but she got it unplugged and got him over to the shower, and the curtain's there, and I'm still just doing the work, just intention wise, and I'm just hanging out, on the other side of the curtain, and he pops his head out and he goes, I felt that. and his pain was gone, and the next thing I knew, he was walking around the hall, and he was going to be discharged. So, yeah.
I have a question. So, we're Reiki masters, and with the Reiki, we have symbols that we use to, we activate our Reiki with symbols.
Okay.
Does Healing Touch have symbols?
We do not have symbols.
Okay. How is it activated? Just by your intention?
Yes, intention, and then we ground, we heart center, we intend for the highest good, and we attune with them, the person, and then we recognize that one source of power, our creator, divine, that's providing us with that energy. So that's the source of that. Yeah. Did that answer your question?
Mm-hmm. Absolutely, yes,
Yeah.
thank you.
Yeah. Any other questions? Comments?
Jane, how do we hear about classes? I've taken course 1 before, but it's been so long ago. I feel like a refresher would be helpful, but how do we advertise your classes?
That would be great, yeah. We have a list of the classes. It's on Healing Beyond Borders website. And then at the hospital, there's some flyers around, but I can also send it to you. So yeah. And then once you've taken course 1, if you want to do a refresher, it's not, you can come in as a helper, or you can take it as a repeat.
So when is your next class for the first one?
April 15th and 22nd, so it's 2 Wednesdays.
Okay, so April 15th.
Yeah.
And 22nd?
Yeah.
And that's for course 1.
Yes.
On the flyer we have, it says September is the next one. Is it maybe just an old flyer?
If you go to the yes, the flyer needs to be updated.
Okay, so where do we go to see that?
If you click on the QR code or scan it, it will show you the correct date. So it's correct on the website,
Perfect.
but it's not correct on the flyer. So
We were very excited to take this, and then we're like, oh, we're going to have to wait till September. So
yes, no,
would be
April.
lovely.
April would be great. Yeah, you bet.
This is on the Healing Beyond Borders website.
Yeah, the classes are listed on the Healing Beyond Borders website. And then also there's some flyers around Methodist that has listed
Other
too.
classes here.
A lot of times they're here. Sometimes a different location, but a lot of times they're here, so. And it's fun. And you get, if you're a nurse and you need CEUs, you get 18 CEUs, so it's the most fun CEUs you get.
And level 1 is 2 days.
Yes,
Okay.
2 days, 8 hours. We do take a full hour for lunch, so that's not something we nurses are used to, but you'll like it, yeah. Any other questions, comments? Has everybody had a treatment before, or?
I used to work with someone who did Reiki, and she sent me stuff when I was really stressed and stuff, and it helped a lot.
Okay, so you have long distance?
Yes.
Yeah. Yeah, wonderful.
I had just a fun, well, I don't know if it was a fun experience, but it was an interesting experience when I took the class. One of the therapies, I don't even remember which one it was, but I had lost a daughter that had passed away. So it's been like 11 years now, but when I took the class, it'd been only like 5 years maybe. But I just started crying, like out of the blue. It was crazy, but it was really cool and therapeutic at the same time. But would you know which one it was? I think it was one where there was no touching.
Probably the modified mesmeric clearing,
Maybe.
because that works in the physical and emotional field. So might have been, or it could have been the last one we do is what we call a chakra spread. I wonder if it was that one. 'Cause that was so beautiful.
Yeah, that sounds right.
Yeah.
And I've done off and on some of this with students here at the college. I work in campus health, and I need a refresher. So my nurse and I both take it in level 1. So, but we like to take other courses. So, but
Yeah, wonderful. Yeah, it's so great too to be able to combine it with. Yeah. Awesome. Yeah. Yeah, because even, a lot of, whenever we have, like recently I was kind of wound up about something and I sent a text to one of my mentors, like, well, I'm kind of mad about something. How am I supposed to get, heart-centered and grounded? And she's like, it's just stuck energy. So, she just helped me do a little clearing and then I was able to come back into heart center, because a lot of times when we have even like emotional negative thoughts and things like that, it's just stuck energy. So sometimes if you can combine that emotion with some of this energy work, it can really help. So, yeah. Well, thanks you guys for coming.
Thank
Yeah.
you. All right.
Yeah. Yeah, and if you ever have any questions, feel free to reach out. Thank you. And here's a list of resources. Healing Beyond Borders is a great resource for more information about Healing Touch and where you can learn more and take the classes.